Yeah, you heard it right. There's just a recent announcement that NEET pattern has changed. I mean, already there was so much of confusion whether NEET will be there or not there. Now they are saying that the pattern has changed. Let's panic. I mean, it is the right time to panic. Why am I talking about it? First, relax. I know I wanted to create some sensation. There is no announcement as such that the pattern is changing or anything else. But why I want to talk about it is that every fourth message which I get on WhatsApp or email or on my website is like, the pattern has changed. Now one liner MCQs are more important, image based questions are more important, so everyone is panicking. So this is the right time I thought that I will clarify and take you to the mindset of how a question paper is made. Let's see. I mean, there could be two kinds of professor. One is a sincere one is a lazy one, and they are given the opportunity to make a question paper. Let's look at the sincere professor. What he would do, he would first go through the previous year questions of the same exam or various different examinations. He will then also try to put down a list of important clinical topics, and finally critical and path breaking advances in his field. So these are the things which he will try to understand, analyze, and then form a paper. So what kind of questions will he form? These are basically the latest research which has gained clinical importance or which will be clinically very important moving forward. Like say a mutation, EGFR mutation, a lot of questions has been asked on that. Why? Because suddenly a lung cancer patient, if he has EGFR mutation, the treatment is different from a lung cancer patient who is not having an EGFR mutation. Obviously, he will never like to leave behind clinically important topics and previous year questions, but he is very sincere, so he will not repeat the questions. He will modify the current questions, change some options, put in some more options, change the clinical scenario, and basically these kind of questions will be modified questions on important topics. These topics are evergreen topics. Now let's look at the lazy professor. I mean, what will he do? He will simply go through the previous year paper and exact repeat from important examinations. So he will just go through important examinations and try to repeat many questions from there and maybe change a few questions here and there. There are so many times when we actually see repeat questions from previous year examinations. Now there is also a third element. Many of the professors rely on their postgraduate students to form questions, to help them form questions. Now again, he will, just because he has cleared his entrance examination, again he will be analyzing the previous year questions and making some modifications or maybe giving some repeat questions. Or if he's a sadist kind of a person, he will try to make an MCQ of a corner of a page, very less important topics, very less important points which nobody never reads, right? So those are useless questions which you see sometimes in the examination and they come out of nowhere. You are never sure, and even if you have read that page 3 times, 10 times, no matter how many times, you still will never focus on that line. So that is how such kind of questions come into the papers. So in total, if we see, these are the 4 different kind of questions. Now let's look at the new questions. About 10 to 20% of the question these days are new questions, latest research backed questions. For these questions, the references is in the latest research papers or PG books which postgraduate students read for their PG courses, and there is no way you can read it. I mean, you cannot follow latest research papers or PG books while you are an undergraduate. So what should you do? You should follow the latest papers of pioneer institutes who are research oriented, like AIMS, PGI, JIPMER. I mean, such kind of institutes which have a knack of picking up in clinically important topics and forming questions on that. So suppose there is a question on a molecule called exenatide this year. So, and it's a very new thing. You have not read in your undergraduate, or there has been no questions on that. You go dig it on internet, ask some senior student, and go to forums and find more about that particular molecule and read about it. So this is how you can learn about the latest questions. And obviously, if it comes in examination, use all what information you have and make a good guess. Second are modified questions on important topics. Trust me, this is the most important part of your preparation. About 50 to 60% paper is modified questions on important topics. This is critical to success. It follows a 20-80 rule or 80-20 rule, where 20% of the topics you have to study very well and revise, because if you confuse in such kind of questions, I mean, it costs your PG seats. The third kind of questions, which I said, useless questions based on statistic pleasure. I mean, questions which you typically, data which you typically don't remember and they are asked in questions. I mean, trust me, you cannot prepare for these questions. Still, they form around 5 to 10% of the paper. You can't do anything about it. I mean, just guess in the examination based on whatever you know for sure. You cannot prepare for such kind of questions which are asked from any nook and corner of a page of a book, right? And the final is exact repeat from important examination. This again can be 15 to 20% of the paper. Nowadays it's a little less. In some exams it may be a little more. Previous year questions of the important exam or the exam which you are appearing, like say if you are appearing for a BHU examination or PGI examinations, past 5-6 years questions of that particular examination becomes very critical. And trust me guys, you cannot afford to get these questions wrong. So solving the previous year questions, even though they may be not repeat, you still very critical for the PG entrance examination. This is to end. There are 3 cardinal rules of success. Follow the 80-20 rule. Second, revise. I mean, if you get confused between options in some 20-25 questions, you are out of the game. And finally, solve questions regularly. And finally, don't panic. Look, in any examinations, there are things which you don't control, but there are certain things which you control. You control that you complete your syllabus before going to the examination. You revise ruthlessly and you solve questions. So the mantra is, don't focus on things which you don't control and give your 100% to things which you control. Finally, I mean, completing the PG syllabus itself is one of the most critical factors for appearing for PG entrance examination. Most students would not have covered their 4-5 major subjects. I mean, especially the anatomy, physiology, biochemistry, or maybe even the SARP subjects. So with Medico Apps, I mean, we have made a commitment among all of us that we are going to complete the syllabus in 6 months. For on information, if you are seeing new, you can visit www.medicoapps.org. Hope you don't get panicked whenever someone is talking about there's a change of pattern or there's a change of questions or new kind of questions are coming. You just focus on your basics, do ruthless revision, solve your questions regularly, and crack PG exam.